My name is Meletta Cocoricha, and I'm a fourth-year pharmacy student at the University of Louisiana at Monroe College of Pharmacy. I'm here today to talk to you as a collaborating author for the research poster titled Students' Attitudes and Perceptions of Prescription Insurance Processing Exercises in Pharmacy Practice Lab as a Primer for Community IPPE. Community IPPE is a requirement for first-year pharmacy students' advancement in their pharmacy curriculum. Community IPPE allows student pharmacists to experience the key fundamentals of community pharmacy practice, such as prescription insurance processing. Integrative Lab Sequence 2 uses stimulated prescription insurance processing exercises to prepare students for their upcoming community IPPEs. This study assesses first-year and second-year student pharmacists' attitudes and perceptions regarding their Integrative Lab Sequence 2 stimulated prescription insurance processing exercises and its effect on their community IPPE. It is hypothesized that students will feel more confident in starting their community IPPE due to experiencing the stimulated pharmacy practice exercises regarding prescription insurance processing offered in the Integrative Lab Sequence 2 class. To assess student pharmacists' attitudes and perceptions regarding stimulated prescription insurance processing exercises, an electronic survey was offered to first and second year student pharmacists. This electronic survey contained 13 questions in which used the Likert scale, with responses ranging from strongly agree to strongly disagree, or extremely difficult to not at all difficult. 170 student pharmacists were asked to respond to this survey. 159 student pharmacists responded to the survey. Student pharmacists' responses were analyzed, then categorized by either if they agreed or strongly agreed, or disagreed, strongly disagreed, or disagreed, and not at all difficult to extremely difficult regarding the stimulated prescription insurance processing exercises, and were they asked if they were necessary for their community IPP and if they felt more prepared for the upcoming community IPPE after completing the stimulated insurance processing exercises done in Integrative Lab Sequence 2. Pie charts were utilized to distribute the different categories of responses from the student pharmacists, such as overall, I feel that my prescription insurance lab exercises prepared me for my community IPPE. I feel that my prescription insurance lab exercises were necessary prior to my community IPPE. How similar was intern insurance information compared to insurance lab exercises in pharmacy practice labs? Or how similar was processing adjudications compared to the prescription insurance lab exercises in your pharmacy practice labs? Next, we will have Agape to discuss the results with you.
Hi, my name is Agape Skinner, and now we're going to talk about the results from our survey. We had 159 students respond to our survey, which is over 90% of the P2 and P3 class for that year. While completing their community introductory pharmacy practice experience, 80% of students had the opportunity to enter insurance information on a patient profile, and 74% of students had the opportunity to process an adjudication at least one time while on their rotation. When asked whether students felt that the prescription lab exercises were necessary prior to completing their practice experiences, 45% of students agreed and 32% strongly agreed that these practice labs were necessary. While assessing overall preparedness, we found that 41% of students agreed and 9% strongly agreed that participating in these practice lab exercises helped prepare them for their community introductory practice experiences. When comparing the utilization of simulated software to teach students how to enter insurance information on a patient profile, we found that the process at their practice site was at least somewhat similar. for over 50% of the students, with 26% finding it very similar and 15% finding it basically the same. Again, with processing adjudications, 50% of students found the software similar to whatever was used at their practice site, with 16% finding it very similar and 6% finding the process basically the same. For our conclusion, we found that simulated practice exercises that teach P1 students clinical, professional, and technical skills such as prescription insurance processing are beneficial in preparing student pharmacists for their community introductory pharmacy practice experiences. We had the opportunity to gather information about how students felt during their community introductory pharmacy practice experiences compared to the insurance adjudication lab exercises offered in the Integrated Lab Sequence 2 course, or otherwise known as ILS 2. In this study, we wanted to determine if the insurance adjudication lab exercises completed during the school year were beneficial in improving student preparedness during their introductory pharmacy practice experience. This information is important because we have previous research that has shown that students feel more confident processing adjudication claims after their second lab exercise as compared to after the first one alone. Our insurance lab adjudication exercises are completed using simulated pharmacy software. Because many community and retail pharmacies utilize various types of pharmacy management software, it would be ideal for the simulated software to be as close of a match as possible to what is commonly used in retail and pharmacy settings. Having this insight on field experiences can be used to identify similarities between simulated exercises and pharmacy practice experiences to determine if changes need to be made to the curriculum. In doing so, we can improve the quality of up-and-coming healthcare professionals in the retail and community pharmacy setting.